Pathologists are physicians who are specially trained to diagnose and characterize diseases based on tissue samples. Pathologists are like medical detectives, searching for clues and answers.
Pathology impacts almost every medical specialty, and most patients will have had a pathologist involved in their care at some point in time. But in Canada, the pathologist is usually behind the scenes, so we don't actually directly see the patient, but we do directly impact on their treatment and management because we're consulting with their physician. That's why pathologists are sometimes known as the doctor's doctor, because we are working directly with the clinician rather than directly with the patient.
Surgical pathologists examine tissues and other specimens that are removed from the body during surgery.
So any gallbladders that come out, appendices, anything like that, we look at them just to make sure that what the physician thought was going on when they took it out is actually what's going on. This uterus was removed because of fibroids, which are usually completely benign tumors that arise in the uterus and can cause pain for the patient. And normally an unpregnant uterus is quite small, but this is very large, and it's because of all these tumors, and you can see them, they're very obvious. These are fibroids. Now in this case, we've got lots of smaller fibroids, and I know when I say small, that seems strange because they look very big, but you can get them the size of a football, and it's the bigger ones that are more worrisome for cancer.
Pathologists take great care to ensure their work is precise and accurate. Much of their determinations go into the diagnosis and specific treatment plan for a patient. Their skill in investigation and analysis can dramatically affect patient outcomes. Their mantra is personalized medicine.
Everyone's sample is potentially unique, and that there are different questions that come out of each patient sample. And sometimes it's a matter of having the foresight to contact the surgeon or contact the requesting physician, such as a gastroenterologist, and telling them that, you know, I'm issuing this diagnosis on this case, but you need to understand that I'm doing it because of this situation that you've described clinically. Or if they've got a question about, you know, I performed this surgery and I wanted to know about this part of the specimen that we don't routinely comment on. Mark, can you tell me what does it look like? So providing a personal touch to each specimen that we get. It's not good enough for me to just look at something. I want to know what the story is behind this. It helps me make a better diagnosis, but also helps me put things into context.
The In60 program is an initiative by the Manitoba government to ensure that patients who are suspected of having cancer receive their diagnosis and their therapy is initiated within a 60-day period.
Pathologists obviously have a big role to play in this program because we provide a critical bit of information that is the confirmation often of the malignancy. So we're very sensitive to the time frame it takes from specimen receipt to issuing of results and communication of results to the treating physicians. That way treatment can actually initiate. We're a big piece of that puzzle and a very important bridge to initiate therapy.
I think a good pathologist would be somebody that really enjoys learning and also really enjoys solving puzzles. Because basically what you have to do as a pathologist is you have to first use your medical training in medical school to first understand the context of what's going on with a particular patient. And then after you understand that clinical context of what's going on by the notes that we get from the general practitioners or surgeons, you then have to either look at a slide or look at different molecular testing to be able to take those pieces of the puzzle and put them together to be a good pathologist. The other skill set I think that is key is also to be a very good communicator, because you have to be able to communicate with different physicians on a daily basis. And again, our diagnosis is only as good as our ability to communicate that clearly.
Well, certainly if you're someone who is visual like I am, who's really fascinated by science and biology, the human body, anything like that, pathology is an amazing career. It's intellectually challenging. It impacts the care of almost every patient in the healthcare system. So it's a very important job, it's a very interesting job, and definitely something that people should be aware of and consider as a career.